Diabetes is a disease that affects how the body processes a sugar known as glucose. The level of glucose is too high and the result is a disease that affects the kidneys and blood flow to the body. Patients with severe forms of the disease have suffered loss of kidney function, eyesight, and even limbs. As advances in medicine have occurred, the condition has not affected people the way it used to, and many diabetics are able to live longer, healthier lives. Recognizing diabetes symptoms early on is crucial in protecting one's health. Doctors have yet been able to determine what the true cause of diabetes is. Thoughts are it may be a disease some are more genetically disposed to. With type 1 form, patients are insulin dependent. This is because their body produces no insulin to help process glucose. This version of the disease often strikes in young children to those in early adulthood. It used to be devastating physically, still can be, and patients were not expected to live very long lives. As history has shown, newly diagnosed sufferers have been able to do things previous sufferers never dreamed of. One of the most recent creation has been a pump that administers the insulin, so that one can go about their day enjoying the same activities that others can. No more needles. Researchers are also studying the use of stem cell therapy to see if insulin injections will be required in fewer diabetics. Type 2 sufferers used to consist of mainly older adults, but as the generations have become more and more overweight, even younger people are afflicted with this form. This was previously unheard of. Either sufferers produce no insulin or the body does not create insulin effectively. This version of the disease is also one that responds well to a change in lifestyle. Many patients have been able to forego drug treatment when these changes are made. They have found that by losing weight, eating foods appropriate for diabetics, and exercising, they can often stay off medication. Gestational diabetes occurs during pregnancy and often disappears after a woman has given birth. However, some women become susceptible to type 2 after contracting it during pregnancy. Some signs of the disease are excessive perspiration, frequent urination, increased thirst, and fatigue. Though these are not the only symptoms, it is important to look for any changes. The sooner one knows they have diabetes, the better the chance of living a normal life. Learn more at in-diabetes.com.